Thank you, everybody, for joining us here today to learn about these two fabulous tools that we hope will help improve your practice. We really invite you to turn on your cameras if you're comfortable, most certainly at the end when we have time for question and answer, because we'll ask you to just simply physically raise your hand into your camera and ask your question. You, of course, are welcome to put any questions into the chat box. My name is Jennifer Seidman, and I am the Director of Community Engagement at Courageous Parents Network. As such, it's primarily my role to interact with patient organizations and with parents. And so I'm really excited today to host Kim Hendry from the Child Neurology Foundation. And then this is my coworker, Chrissy Sally, who will be sharing NeuroJourney with you today. Because both of these tools, I think, are going to be valuable to you in your practice. When my son Benjamin was diagnosed with Sanfilippo syndrome, which is a severe neurological impairment, I started to realize very quickly that it takes a village to raise a kid like this, and that village had a lot of players and a lot of pieces, and keeping track of all those players and pieces was a lot of work. And so what I'm hoping is that through this relationship, this collaborative relationship that we're building with the Child Neurology Foundation, and you'll see them represented throughout the NeuroJourney tool, is one that's going to help families and you as clinicians put together the resources into the right bucket that they can actually carry along. Courageous Parents Network does a lot of, we provide a lot of digital resources to families to nurture them throughout their disease trajectory, and certainly NeuroJourney, which provides some medical content. But we also do not have resources for many of the things that Kim is going to share with you today. So it's a nice unison to bring it all into one place. So with that, I'm going to turn it over to Chrissy Sally, my coworker, and she is going to share her screen and tour you about NeuroJourney.
Thank you, Jennifer. My name is Chrissy Sally, and I am the Director of Clinician Engagement and Outreach at Courageous Parents Network. I'm really happy to be presenting NeuroJourney to you today. This will be a fairly quick virtual tour, broad overview of NeuroJourney, but I will be hitting some really important highlights so that hopefully you have a sense of NeuroJourney's design and background, a sense of the content, and how it may be helpful to the families that you work with. First, you'll see on the screen is a bit of a timeline of NeuroJourney's development. So the concept for NeuroJourney began about 3.5 years ago or so, when Dr. Rachel Thean-Prayun, who is a pediatric palliative care physician at Cincinnati Children's Hospital, approached Jennifer and CPN's executive director, Blythe Lord, about a journey map that was being developed at the time for families caring for children with Duchenne muscular dystrophy. And Jennifer and Blythe reviewed the tool and engaged in conversations with Rachel. And as they saw how that tool worked, they all together said, wouldn't it be wonderful if there were something like this for families journeying through severe neurologic impairment? And so that is where the idea of NeuroJourney was born. They engaged a company called LiveWell Collaborative, which makes digital health resources, and started building the concept for what NeuroJourney might look like. Jennifer and Blythe sought out many expert contributors, some who provided written material and those who also reviewed. Our primary medical writer is Dr. Julie Hauer, who is a physician on the East Coast through Boston Children's Hospital and is an expert in caring for children with SNI. And Jennifer Seidman wrote most of the psychosocial section of the NeuroJourney, which infuses a lot of the parent perspective. So just like all of CPN's resources, we look at the intersection between both the medical and parent perspective. NeuroJourney went through a few rounds of beta testing, which covered things like user experience, but also content and use of language by anyone who we felt would be a primary stakeholder or user of NeuroJourney. So certainly expert medical reviewers, but also executive directors from patient organizations that we thought might be interested in referring NeuroJourney to their families and bringing the family perspective. and also parents and caregivers who cared or were caring for children with SNI. And NeuroJourney, through all of that, finally launched in November of 2023. So we've been really thrilled to roll it out and present it. I'm going to go back to the top of the screen and get to the main homepage for NeuroJourney to give you a sense of what is there. Our expectation is that the primary user of NeuroJourney is a parent caregiver, but you will see that this is also an opportunity for families to share this resource with extended family members like grandparents or aunts and uncles or community providers who may not know a lot about SNI. And are eager to learn and understand what SNI is and also what the family's experience is. And we've also received quite a bit of feedback that NeuroJourney is an important opportunity to be used as a teaching tool for learners in the medical system. So as you scroll down the main page, we have an introductory video, which for the sake of time, I will not play today, but the video does two things. First, it describes what severe neurologic impairment is to orient the user to that language. It has certain narration, but also imagery to illustrate what we mean by that. And then the second half of the video describes what NeuroJourney is and how the user might navigate through it. All of NeuroJourney is based on the concept of the arc of a life. And this is a concept that our founder and executive director, Blythe's husband, coined when their daughter Cameron was diagnosed with Tay-Sachs disease. At that time, he said her life may be short, but it will have a full and meaningful arc. And this is something that we stand by and hold true at Courageous Parents Network. We believe all lives have a beginning and an end, and then there's everything in the middle. And our belief is that all of these children can have full and joyous lives. So you will see here that for NeuroJourney, the arc is represented by these 4 circles, and the gray swirly line that you see represents the nonlinear aspect to that. You will also see here in these 4 colors that we have divided NeuroJourney up into 4 phases, and they look distinct here and they're presented as distinct, although we know in reality they may not be of equal length and the lines are a little blurred. However, we have received feedback that both parents and clinicians felt that some parents may benefit from having a sense of where they are at in their child's journey. So you could think of this as a prognostication conversation opportunity to have with families, and it gives them a sense of where they are at. The language that was used in the 4 phases was tested with parents to find something that was meaningful and also tolerable for them to read and hear. And as we scroll further down this page, you will see a description with this peach box with a heart symbol. This represents the palliative aware voice or the companion voice that is based on ideas related to pediatric palliative care that follows the user throughout all of NeuroJourney. So at CPN, we are fierce advocates with a little a for pediatric palliative care. And we have infused that all in NeuroJourney to accompany the family on their journey. As we scroll further down the page, you will see that each of the 4 phases is described, and you can enter the NeuroJourney map, either the medical or the social and emotional map, under these descriptions for each of the 4 phases. And beneath, we have highlighted 4 core concepts. These 4 concepts were chosen because this is language that is used repeatedly throughout NeuroJourney, and it was important to us that we orient the user from the beginning on what we mean by these 4 concepts. We also highlight these 4 because this is language that providers use, and at CPN we're always looking for ways to empower parents with a shared language with their clinical team. So with that, I will scroll to the top of the page because that's how I prefer to navigate. Although, as I said, you could enter at each one of those 4 phase sections. And I will point out that we talk about NeuroJourney as one thing, but we really have 2 separate maps. We have the medical map and then the psychosocial map. And I'll introduce you to the medical map first. So as I scroll down here, you will recognize those 4 phases and those 4 colors that I pointed out to you on the home screen. On your screen, you will see that from left to right, we have each of the 4 phases representing time. And from top to bottom, we have the systems or symptoms that the family can expect they will need to learn about over the course of their child's life. And they can anticipate that they will likely have to make decisions in each of those domains for their child at some point during their child's life. You will see that we have 2 sections that are being crafted right now, and this is a good time to remind us all that NeuroJourney is never done or complete. It is a living, breathing object that will always be adjusted. For the sake of today's presentation, I am going to dive into the gastrointestinal section to give you a sense of what the informational pages look like. All of the pages are organized and formatted in the exact same way. So once the user gets a sense for that, it makes it very easy to navigate through NeuroJourney. At the top right-hand side of the page, we have the title for that page's topic area. And underneath, we usually have a small paragraph or sometimes just a few sentences, but it does 2 important things. One is it describes for the user what we mean by that title area, and importantly, it explains why we're raising this as an issue for children with SNI, and it is a teaching moment. It teaches the parent or any other user that what is going on in your child's body in this domain or in this area or system of their body is ultimately related to the problems of the brain and central nervous system. And we hear very often that concept, the connection between what's going on in the body systems and the child's brain, is a hard concept for families to grasp, and sometimes it could take many years before they fully appreciate that is the case. And it's especially challenging when families are treated in a piecemeal way and they see different subspecialists that are treating, isolated areas without looking at the holistic picture. On the left side of the page, you will see that we have listed the providers who might be helpful to you within this domain. If you click the little arrow, we give a very brief, somewhat generic description of what that provider does. But beneath, we say a little bit more specifically about what that provider will do in this area. You will also see a few icons. So first, any of these pages can be shared by clicking the share button, which will generate a link. We have heard that a lot of providers are now putting these links in after visit summary notes related to the topic area that was discussed in that visit or appointment with the family so that they have additional reading material. The other icon that's important to note is this triangle, which is audio. So all of NeuroJourney is accompanied with audio to relieve some of the reading burden. It also addresses different learning needs. We are excited to share that this summer we will be posting Spanish language audio, and we expect to have French language audio by the end of 2024. Now, gastrointestinal is a very broad domain. So as we scroll down, and this is just how all the topic pages are, we get into further level of detail. So for example, a family could learn more about motility, constipation, and diarrhea by clicking on this link. Again, you will see the formatting is exactly the same with the title on the right, a description beneath it, a list of the helpers and how they might help in that area. And then as we scroll down, the technical information appears. So on the left side of the screen with the white background, we have a lot of information for what may occur for your child at some points in their lifetime and what you, mom or dad or caregiver, could expect to anticipate. It often has hyperlinks to other areas within NeuroJourney, which I think is another way that shows the interconnectedness of some of these topics and areas for the family. And then on the right side, of course, we have that palliative voice that really does 2 things, I think. One is it's noting that as you are reading all of this technical information on the left side of your screen, it's probably evoking some feelings, and we want to validate that for you. But we also validate, normalize, and give some helpful language for you to use with your child's team about how issues in this domain affect your life outside of just reading NeuroJourney. You can navigate back and forth with these areas or the back button on your browser. So briefly, I'll show you that if you click back here for feeding tubes, you will see the page is formatted the same way. In this case, we used a chart to describe the different types of feeding tubes that exist because that was a nice way to present that type of information. And this page is also a good example to highlight that on some pages we link to resources back on courageousparentsnetwork.org that are relevant to that topic. And occasionally we link to external resources that we have vetted if we think that they're exceptional in helping families gain a deeper level of understanding for that topic area. I will scroll back up to the top of the page, and I'm going to take myself back out to the medical map briefly to highlight one more area for you. So I will show you the neurology section, for example. Again, you won't be surprised because the formatting is the same. You will see the description and the helpers. You will see the subtopics that we have within neurology. And this is also a good opportunity for me to show you that in some cases we have a table called present in some children, and these are issues that we thought would be important to name and describe in NeuroJourney, but do not at this time have an entire page dedicated to those topics. And as we get back up to the top of the page, now that we've seen a bit of the medical map, we'll jump over to the social and emotional topics, or I often refer to this as the psychosocial map. Unfortunately, it looks exactly the same way. So once again, we have time going left to right, and then many different topic areas from top to bottom of the screen. We call this section of NeuroJourney CPN Light because Courageous Parents Network, all we do is tend to the psychosocial and social emotional needs of families most of the time. And so all of these topics here that you see in NeuroJourney are also on CPN's website, oftentimes in greater level of detail or with additional resources, but they have been set up for families here in good manageable pieces. For example, we can click on guilt and regret. We have our topic area. We have the description for why we're raising this for you as a caregiver or mom or dad. Why do we, why can you anticipate maybe having these feelings? Who are the people that can support you in that area? And here's what your family might experience, and that palliative voice. And when I'm reviewing the psychosocial section, I always like to highlight a few topics that many providers are happy to know that we have. Specifically, transition to adulthood is a topic that we provide materials on here on NeuroJourney, but also cpn.org. That's a popular topic that people are always looking for resources on. And then we also have a lot of supporting the siblings resources. And when I speak with clinicians who say, I wish I could get a family to NeuroJourney or courageousparentsnetwork.org, but I don't know how to get them in the door. I say, send them, if there's a sibling in the family, send them to the sibling resources because they're all wanting to know how to support their children. That's a great doorway or window into our resources at CPN. I will really briefly point out a few more resources on NeuroJourney that are separate from the maps. So we do have a clinician and provider portal. If you look at the top of the right screen, it'll say log out because I am currently logged in. So if you were to click on this portal, if you do not already have a CPN login, it would prompt you to enter your information. The username and password is the same for both NeuroJourney as well as the clinician and educator portal on courageousparentsnetwork.org. And that gives you access to some resources that are designed just for you as providers. And we do hope that you'll join CPN and just indicate that you're a provider when you do so that it essentially unlocks access to this area of NeuroJourney. We have a basic information sheet. We have a referral order form, which I will show here to you briefly. This talks about NeuroJourney and a QR code for families. We will send these to you at no cost if you request them. Similarly, we have courageousparentsnetwork.org cards that we can also send to you. You could also just email me directly if you'd like to order some of these cards. We created a full page resource, which is an 8.5 by 11 sheet that's printable because we have learned over time that some clinics provide informational binders to families and they preferred that size of resource for their setup. But most importantly on this page, I want to briefly show you this guide we have created for clinicians that tells you how you might introduce NeuroJourney to families yourselves if you're looking for that information. It also provides detailed overview of NeuroJourney. And I always like to point out this section, if you go beyond the conclusion on this guide, this is an example of that outpatient documentation that I referred to earlier. So this was provided to me by a nurse practitioner who is in a complex care clinic. This is a real note that I have anonymized. In the case of this child, they talked about pain. So she made some recommendations for pain management, and then she linked to our pain section of NeuroJourney for the family. Similarly, she did the same thing for constipation for this family. And I will point out for you, sorry about that, one more item of information. That is the caregiver worksheet. This is a printable PDF that we have created for parents and caregivers that they might use to accompany them while they're looking through NeuroJourney. We give them some questions to prompt their thinking. Our hope and intention with creating this is that they might take notes and write down questions that come up for them as they go through NeuroJourney, which we expect they will have. And we hope that by presenting this PDF, we're encouraging them to think of NeuroJourney as a tool to use with their providers to enhance communication, and that the expectation is that they won't go through NeuroJourney alone, that they can go back to their clinical team and bring what they've learned or read. And with that, I will stop sharing screen, and I'm going to hand it over to Kim, who will present resources from the Child Neurology Foundation, and we will hold questions for both of us until the end. Thank you.
Thank you very much. I have absolutely loved NeuroJourney. I will say, as a parent myself, who has a child with some very unique needs, I found it very, very beneficial. So I think I'm very knowledgeable in this space, but you really don't know what you don't know until you go and start researching. So thank you so much for that wonderful resource. My name is Kim Hendry, Program Manager for the Child Neurology Foundation. And today I'm going to talk with you about a program we have at the Child Neurology Foundation aimed at providing support to our families who have a child with a neurologic condition. By support, I mean emotional support. I mean social service support, really anything and everything that a family could possibly need on their journey caring for a child, we can support and help them with. If you don't know much about the Child Neurology Foundation, our goal really is to build meaningful connections between families and medical professionals. And we do this by really being that collaborative center or hub of education, support, and care advancement for our families and our clinicians. This program actually began a couple of years ago now, and it came out of our annual needs assessment that we send to our community, meaning families and clinicians alike. And our families were saying to us that they were really in need of connecting with other families who were walking a similar journey as them. They were struggling to not only connect with other people, but they were struggling with everyday social service needs, such as putting food on the table, keeping a job because they had to care for their child at home and there was no one to care for their child. Just basic everyday things. And they were feeling like they were becoming more and more isolated from their community and that others just really didn't understand. And our clinicians said the same thing. They recognized that our families are struggling day in and day out from an emotional standpoint, and also for just the basic everyday needs. And so what we did is we created a program called our Family Support Program. And within that program, our Neurology Social Services Network, where we have created a network of almost 80 advocacy organizations, national organizations around the country that provide that social service and emotional support to families. Here at the Child Neurology Foundation, that family support is one component. We really have three pillars that we stand on. So we stand on our child and family support pillar. We have a lot of education, which I'll go over as well. And then we also support our clinicians and researchers through research and care advancement. We just launched a lot of grant opportunities for you. So I will talk about that here in a moment. To get back to our family support, which is the main program that I'm going to talk to you about today, how that works is you as a clinician or anyone on your staff or the families themselves can request support from the Child Neurology Foundation or one of our partners through our assistance request form. It's basically a contact us form on our website. Once the family makes connection with us through that contact us form or that assistance request form, we reach out to the family and we contact that family. It's really important to us to establish a relationship with the family. Oftentimes what we find is that families are referred to us for one thing, and as we build that relationship with them, we find out that they need a lot more support. And so we're able to really connect them to the abundance of resources that they really do need to have their feet on the ground. As they reach out to us, we have a lot of different options here at the Child Neurology Foundation. We have a peer support specialist on staff that we can relate to the families and really provide emotional support that way. If it is, if the family has a child who is diagnosed with a specific condition that we happen to be a partner organization with, we will refer them to that organization. We also can refer them to over 25,000 different social service organizations in around the nation. And so we can help them with really anything and everything you could think of, from food, housing, employment, respite care, and the list goes on and on, down to school supplies. We can support families. We can also, as I said before, refer them to another advocacy organization. That includes Courageous Parents Network. We can get them connected to NeuroJourney. We can get them connected to, a multitude of different organizations that have the latest and greatest information on the clinical trials, the best treatment options, the doctors that are in their centers of excellence and other areas around the nation. We can also get them connected to financial assistance. That's a big one for our families as well. Once we get them connected to those supports, we continue to maintain contact with that family. And the reason we do this is because our families have indicated that they are in crisis multiple times a year. And we want to make sure that they have the support that they need day in and day out. Here are some of the educational options. My goal is not for you to remember every education opportunity that we offer or that our partners offer. Just know that we do offer it. So if there is something that your families need, we will get them connected to it. Anything from transition from pediatrics to adult care, genetic testing, epilepsy management, pretty much anything you can think of education-wise, we can help support that. Obviously, NeuroJourney is a wonderful tool that we can also give our families access to. Another one of the toolkits that we have here at the Child Neurology Foundation is the Child Neurologist New Visit Toolkit. I have actually personally used this toolkit for my daughter as we were transitioning to a new neurologist. Really helped me get all of the information down before I went into that visit. Not so much as to hand it to the clinician, but so that I could remember everything that there was to remember in the journey that we had been on. So it's a great tool for that. We also have a respite care notebook as well that families can utilize to be able to let someone know the ins and outs of caring for their child when they are away. We have a transition of care checklist, very, very utilized by our community. And then a seizure action plan. A lot of families will use this when for like after school activities or when there are other care providers to make sure that everyone is on the same page if there is a seizure. One of the #1 requests that we get at the Child Neurology Foundation for support is for really peer support. It is about 60% of our requests. Families really want to connect with other families who are walking that journey. And that really comes down to not feeling isolated. They want to feel connected to other people. They want to know that they're not alone on this journey. And really that is the best gift I think that we can give them. And then as we get them connected to other families, they also get connected to resources and anything else that they should need. Some of the resource navigation as well, think about mental health services for your families, transportation assistance to and from clinic appointments. All of those things we can help with. We actually have a licensed social worker on staff who speaks both English and Spanish. That has been absolutely wonderful as our Spanish population continues to grow. We can serve more people, which is absolutely wonderful. We have partnerships, as I said before, with almost 80 advocacy organizations across the nation. That really does allow us to get our families connected directly to those organizations that know the most about their condition and can really make those families feel connected and less isolated. If you're wondering about the impact of our program so far, we actually have a breakdown here of some of the services that we've provided. Again, you can see that peer support is a big one, but really our families need everything. They really do. Housing is one of the most difficult things to find, but one of the requested services. Income support is absolutely huge. Our families are spending so much more on medical expenses every day. There are so many families who are just struggling to get to a clinic appointment. The introduction of telehealth has obviously been very helpful for families, but they still need to get to see their provider at least once a year. And so if we can make that happen for them, that's really important. Not only that, but here at the Child Neurology Foundation, we are very proud of this Neurology Social Services Network, which is that 80 advocacy organizations that we have collaborated with. And one of the things that we are doing on the back end here with the Neurology Social Services Network is collecting de-identified data about what our families are requesting, and we're able to find them, and what they're requesting and we're not able to find them. This is really important because what we've preliminarily found out from this data is that there is not a group of social service organizations for just children who have complex healthcare needs. There are things out there for veterans, there are things out there for single moms, people who have substance abuse disorders, but when it comes to children with complex healthcare needs, that pocket of organizations just doesn't exist, making it that much more difficult for our families to get those services. Our goal with this data, again, it's all de-identified data, is to really be able to showcase that our neurology community really needs these services, that we are struggling, our families are really struggling day in and day out for so many different kinds of services that don't exist. And so a lot of our partners have already started talking about programs that we can implement to help ease that burden on our families. We're really, really looking at this data and saying, how can we make a bigger impact for our community and really create these programs so our families don't suffer alone every single day? How do you get connected with us? Please fill out our newsletter. Our newsletter we send out monthly, and it gives all of the latest and greatest information that is happening at CNF. As I said before, we are giving out over, $26,000 quality improvement grants this year. Those are just now opening up, so please reach out if you are interested in some of those quality improvement grants around care coordination and transition of care, two very big topics right now. We also are getting ready to launch an educational course called Surviving to Thriving. That is for families. It is a free course for families to take to really help their mental health and wellness, because we know that our families suffer, and a lot of that has to do with isolation, and we want to be able to help our families so that they can help each other as well. You can get to our family support assistance request form by scanning this QR code here. That'll get you directly to that page. You are more than welcome to email me at programs@childneurologyfoundation.org. I can send you our family support handout, which you can have access to. You can have it available in your clinic. Some clinics have said that they post that right next to the sign-in kiosk or at their front desk where families sign in. Just a quick, easy way for families to be able to get connected to the support that they need. We are also able to provide specific training to any social workers that you have at your clinic or any staff that you have in your clinic on how to utilize our program. And you are more than welcome to fill out our assistance request form on behalf of a family. We take any and all requests, any way that we can support our families. So please utilize us. It's a free service, and we want to help as many families as we can. Thank you.
Oh, Jennifer, you're on mute.
Thanks, Kim and Chrissy, today for sharing. And